Thank you for inviting me to be part of this important forum. Can I start by acknowledging the traditional owners of the lands on which you meet and pay my respects to elders past and present. I extend that respect to other First Nations people joining today. I'm recording this on Ngunnawal and Ngambri country, and I pay my respects to their elders past and present. I scarcely need to tell this audience that we are facing a climate emergency. Climate change is already impacting our health. Devastating bushfires, flood disasters, changing rainfall patterns and heat waves are all taking a toll on people's physical health and on their mental health and well-being. The system itself is part of the problem as a significant contributor to greenhouse gas emissions. Globally, the sector contributes around 5% of total greenhouse gas emissions. So that means the health system has an important role to play in contributing to national emissions reductions efforts. The Australian Government has committed to developing Australia's first National Health and Climate Strategy. We will tackle climate change head-on, mitigate greenhouse gas emissions in the health system, and take action to adapt to the health impacts of climate change. But we know that we can't do this alone. I've had the pleasure of hosting 3 roundtables in Melbourne, Canberra and Perth, as well as online First Nations focused roundtable in developing our strategy. Can I take the opportunity here today to acknowledge the work of the sustainable healthcare champions and health institutions who've taken part and who've been driving change for many, many years. I particularly acknowledge KAHA and members of the Global Green and Healthy Hospital Alliance in the Pacific region. Reducing the health system's impact on climate change starts with improving people's health and optimising care. This includes preventing ill health, reducing demand for healthcare in the first place, and eliminating unnecessary tests and treatments. Key sources of health systems emissions are the built environment and facilities, travel and transport, medicines that emit emissions at point of use, food and nutrition waste, and the supply chain. The Department of Health and Aged Care is working to develop ways to tackle each of these emissions sources. This will form one important part of the strategy. The kinds of things we are looking at to reduce health system emissions are many and varied. Promoting electrification in buildings and vehicles, energy efficiency, telehealth, hospital in the home, green procurement, more environmentally friendly respiratory inhalers and anaesthetic gases, all can play a part in a cleaner, greener future. Each and every one of us, nurses, allied health staff, doctors, patients, families, estate managers, catering staff, cleaners, procurement staff, accountants and health service executives, each of us has a responsibility and role in decarbonising Australia's health system. The Australian Government looks forward to working in partnership, including with everyone at this conference, to build a healthy and sustainable healthcare sector in the years to come. I wish you well in your deliberations and I look forward to working with you in the future.